Everyone. Welcome to the Happy Flosser podcast. My name is Billy Luntz. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It is so fantastic to be with you today. And this episode that we're going to be talking about today, it really talks and thinks. I want you to think. Oh no, if you're not ready to think today, you better just stop listening now. Okay. I want you to be thinking about your inside, your inner landscape, right? We're going to be talking about dental hygiene ethics and not like beneficence and all of these things, like your true values, your beliefs, and your attitudes. These are the core things that shape how you show up for your patients, how you show up for your colleagues, how you show up for your classmates, and how you show up for yourself. And instead of treating ethics like a list of rules, in this episode, I want to dive into the why behind our ethical behavior and how our own personal and professional values kind of cross the road together and intersect with the clinical setting and who we are when we show up to our patients. So when we're talking about ethics, ethics in dental hygiene isn't just about the ADHA Code of Ethics or a chapter that you've been told to read in your textbook by your faculty. It's really about how you think, how you feel, how you interpret a situation, and how you make decisions when nobody's watching, right? It's not right versus wrong, but it's about navigating the gray. You know what I figured out in life, guys? It's taken me a long time. Everything is gray. There is no black and white. So, the level of self-awareness you have to have in order to finally get to the realization that sometimes it's really hard decisions that you have to make. And it makes you question, like, why is this so hard? And why are there so many gray areas? So, what I want you to do, let's first talk about your values, right? This is our inner compass. This actually guides our true behaviors. Values are those deeply held principles that shape your decisions of who you are, the core values of who you are, how you respect yourself, how you respect others. Autonomy is a huge one for values, right? Non-maleficence, do no harm. Beneficence, do good. Justice and fairness, right? Veracity, truthfulness. Are you trustworthy? How's your integrity? Why, what is all of this stuff? Like when you want, how would somebody describe you? How would you describe yourself? If I asked you, what are your values? What would you tell me? And I'll tell you why this matters. Values matter because they influence how you respond to ethical dilemmas. They influence how you communicate with your peers and your patients, and they shape your own professional identity, right? I think you should really think about this. What are your three personal values as a person? And then take a look at the ADHA core values and see if you are in alignment. Most of us are if we are in dental hygiene. All right, those are your values. Now let's talk about your beliefs. Beliefs are powerful, powerful. They are assumptions that our brain tells us are truths. Our subconscious mind believes them to be the truth of the world. Okay. So let's relate that to our profession, right? Maybe we have beliefs about how a patient is going to respond if we tell them about their treatment needs. And so we either put limits on ourselves or limits on our patients because we have bias, or maybe we don't even realize there's a story that we tell ourselves, right? I can tell you what dental hygiene students say. They have to get 100 in order to be a good clinician. I have to tell you, the competency is not 100 for a reason. You are learning. If a patient refuses treatment, what are you going to do? What's your belief? Do you believe that it's your fault? If a patient doesn't listen to you or value what you're telling them, What are your beliefs? What are the beliefs that you hold to be truths in your life? I think the minute you start questioning your beliefs as, hmm, let's reconsider that. Let's think about what's possible on the other side of this belief. You're going to start realizing that none of your beliefs are true. It's pretty accurate. It's taken me a long time to realize that almost everything that I believed was true in my 20s was not true at all. So I hope you go on this journey because I'll tell you why beliefs matter. They influence our judgment as clinicians. If we believe a certain way, it's going to impact our judgment. They also affect how we see things, how we interpret the world, how we interpret our patients' behaviors, our beliefs. They also shape our confidence and how we communicate. If I believed I was only a dental hygienist that was skilled to scale teeth and use instruments, I would never have become an educator, a podcaster, a social influencer, and been able to have an impact on dental hygiene students and make learning fun. But I believe something different than I did when I was younger, that I'm capable. All right. So it's important that you challenge your beliefs, the stories you tell yourself. You should listen sometimes to the stories that you tell yourself to see if you can figure out what those beliefs are. Because here's what's cool about beliefs, guys. Beliefs can be examined, they can be challenged, and they can be changed. That is the key right there. If you are not reframing your beliefs to help you grow, the more you know, the more you grow. And once you know, you have to pivot and grow. That's my saying. So that's where belief shifting is so important. All right. Last thing I want to talk to you about is your attitude. My mom used to tell us if we had a bad attitude to go to the front door, open the door, and throw our attitude outside. So, our attitudes are the emotional lens that we bring to the world. We carry these attitudes into all the interactions and experiences that we have in a day. And you know what's cool? What I've told my kids, what's cool about your attitude, it takes a long time to change your values. It takes a long time to change your beliefs, but you can change your attitude in a second. All right. Our attitudes are often shaped by things like our past experiences, the stress and pressure that we're under, a bias, a level of comfort that we have. So, how we are feeling, right? If we're feeling frustrated, when we're feeling anxious, or we're feeling overly responsible for things, or we're under pressure for deadlines and things like that, it can really have an impact on our attitude. And it matters to understand what your attitude is because our patients can feel them. They can see them, even though we're wearing a mask, they can feel them and it influences them. It influences the rapport that you have with your patient. It influences the trust that you build with your patient. It can either support or undermine your own ethical decision making. And I've told you guys many times, the hygienist that you are when you're 30 minutes behind is the hygienist that will be remembered. How you behave, what is your attitude when you are 30 minutes behind? Can the patients tell that you are 30 minutes behind? Ethical care requires a significant amount of emotional regulation, empathy, and self-awareness. And I got to tell you guys, ethical dilemmas will come up. Everyone will experience them. If you're on this planet long enough, maybe 2 seconds, you'll have an ethical dilemma as a dental hygienist. So when your personal values conflict with workplace expectations or your beliefs influence clinical recommendations and your attitudes affect patient interactions or productivity, pressure, challenges, ethical standards, all of these things happen. Your values, your beliefs, and your attitudes will sometimes conflict with ethics, with what the responsibilities are or pressures that are put on you. Maybe a patient refuses x-rays. Maybe a dentist tells you to just clean their teeth. Maybe you notice a colleague who's not practicing infection control protocols correctly. Maybe you feel rushed and you can't keep that schedule as tight as is the expectation, right? Ethics become real in these moments. So, what is it about you that you will be able to say to yourself that you are going to hold yourself to the highest standards of care when you are working with your patients? And what are your values, your core beliefs, and your attitudes that help shape that as you move forward? What is going to be the difference maker? I want you to reflect on your values. See if you can identify some of your limiting beliefs. See if you can notice your own attitude in stressful moments. I want you to practice some ethical reasoning, right? What's really cool, I'm helping my daughter with this right now. She actually told me it's impossible, but I know that is not true. I think I probably said that before to someone else who helped me with it. Whenever she has a bad attitude, I tell her the gift of being human is that you can change that if you want to, and then it won't ruin your whole darn day. You can actually fix it right now. Let's do a little dance and maybe put some music on. You have to do something to reset your brain when you have a bad attitude. Either go for a walk. We have this quad at work, and if I'm having stress or I'm feeling like I'm under pressure, I will just, even if it's cold out, I will put my coat on and I will go walk the quad a couple loops just to kind of change my pace, change my heart rate, change the scenery, change the channel, change my attitude. And I'll give myself an attitude adjustment. And then I'll go back into my office and then I feel great. Or maybe I run across a student who's happy and smiling, and it reminds me of why I do what I do. So sometimes we have to do hard things, but when we can notice our attitude in stressful moments, we can identify it and we can shift. That's what's awesome about attitudes. Beliefs take a little bit longer because you have to identify what your limiting beliefs are and then make those adjustments. Take the limits off your thoughts and beliefs. Oh my goodness. They're all connected, guys. So the minute you just see what's possible. To me, if you can see somebody else in the world doing something, then obviously you can do it too. We all have limitless possibility. It's those beliefs and the attitudes that kind of weigh us down a little bit. So I challenge you to question those. Ethics is just rooted in who you are, not just what you know. So if you're taking an ethics course with me, it doesn't matter what I teach you. It's also who you are. Those values that are in your heart, they guide your decisions. Those beliefs shape how you interpret things, and your attitude influences all the interactions you have. Self-awareness is really what I want to teach you, because self-awareness is the essential piece for quality ethical practice. Ethical dilemmas, they're going to come at you. The universe will make sure of it. Those are opportunities for growth. They are not signs of failure, right? If I know that there's potential for me to fail at something, I just want to do it really fast and get it over with so I can learn my lesson and move on. So the best thing you can do is lead with integrity, lead with compassion, and lead with courage. If you really want to get deep into the weeds of how your values and beliefs and attitudes shape your ethical decision making, you could write a personal value statement. Maybe you could do some reflection on a time when your own beliefs influenced a clinical decision you made. Did you do something with a patient only because you had a requirement you had to do, or were you putting the patient's needs first? Think about an attitude that helps or hinders your patient. Do you get nervous, or are you not as prepared as you need to be when you have that patient sitting in your chair? And so it's actually the patient who's suffering, right? I want you to review the ADHA Code of Ethics and really connect it to some of the scenarios that you've already had in school to really help you dissect your own values, beliefs, and attitudes. All right, guys, that's all for now. Let's talk next week. I hope that you are having a strong start to your spring semester. If you need additional support, please reach out. I'm on TikTok, I'm on Instagram, I've got the podcast here, all little educational tidbits for you to help you on your learning journey. Have a great week. Oh, you know what I wanted to tell you guys? I don't know if you guys are aware of FeedSpot, but FeedSpot is this really great website where they put everything together for all different. So if you were to search the 25 best dental hygiene podcasts for yourself so that you would know what's available for you for resources, FeedSpot is a great place for you to go in order to do that. You just go to feedspot.com and you could type in dental hygiene and it's going to pull up all of them and it rates and reviews them for you so you know exactly which ones you might want to put your time into to spend listening. So hopefully that's a great resource for you guys. All right, I will see you next week. Bye.